Globe World AIDS Day 2025. Overcoming disruption, transforming the response. Today, December 1st, we observe World AIDS Day 2025. It is a day to remember the lives lost, celebrate the progress made, and, most urgently, to recommit ourselves to the goal of ending AIDS as a public health threat by 2030. This year's theme, Overcoming Disruption, Transforming the AIDS Response, speaks directly to the critical moment we face. After decades of hard-won victories, the global HIV response is standing at a crossroads. The urgency of transformation. The latest reports from UNAIDS and WHO paint a challenging picture. Decades of progress are under threat due to significant funding cuts and mounting global disruptions. A funding crisis. Cuts in international assistance have sent shockwaves through low and middle-income countries, where services rely heavily on this support. Prevention programs, especially for vulnerable populations like adolescent girls, young women, and key populations, have been hit hardest, risking an increase in new infections. The rise of inequalities. Punitive laws and discrimination targeting marginalized communities, including LGBTQ+ individuals, people who use drugs, and sex workers, are creating enormous barriers to testing, prevention, and treatment services. When a person fears legal or social persecution, they will not seek care, and the epidemic continues to spread. A sobering projection. Without urgent, transformative action, UNAIDS projects millions of additional new HIV infections by 2030. AIDS is not over, and a new, bolder approach is required. Microscope breakthroughs offer hope. The power of innovation. Amidst these challenges, the science of HIV has never been more advanced, offering a tangible path to ending the epidemic. Innovation provides a powerful counter-narrative to disruption. Long-acting prevention (PrEP), the advent of long-acting injectables, such as twice-yearly lenacapavir and two-monthly cabotegravir, is a revolution. These options can remove the burden of daily pill taking, offering discreet, effective protection for those at risk and simplifying adherence for people living with HIV. Personalized and integrated care. The shift toward personalized treatment, using genetics and data to tailor drug regimens, combined with the integration of HIV services into general primary healthcare, makes treatment more efficient and accessible. The U=U message. The scientific consensus that undetectable equals untransmittable, U=U, remains a cornerstone of prevention. A person living with HIV who is on effective treatment and has an undetectable viral load cannot transmit the virus to their sexual partners. This message is vital for dismantling stigma. Handshake the road ahead. Why community matters most. The 2030 goal of ending AIDS is still within reach, but it requires political will, financial commitment, and, most critically, community leadership. The call to action for World AIDS Day 2025 is clear. Sustain and increase funding. Governments must bridge the financing gap, both domestically and internationally, to ensure life-saving services do not collapse. Uphold human rights. We must repeal punitive laws that criminalize marginalized populations and dismantle the social stigma that pushes the epidemic underground. Protecting human rights is a proven public health strategy. Empower communities. People living with and affected by HIV are the backbone of the response. We must fully fund and empower community-led organizations to reach the most vulnerable populations with prevention, testing, and care. Today, let the red ribbon be a symbol not just of remembrance, but of renewed solidarity and action. Let us transform the current challenge into an opportunity to rebuild our systems to be more equitable, resilient, and human rights centered. We have the science. Now we must secure the commitment to finally end AIDS. What you can do today. Get tested. Know your status. Testing is the first step to both prevention and treatment. Challenge stigma. Correct misinformation and speak out against discrimination related to HIV. Support community efforts. Donate time or resources to local organizations providing HIV services. Would you like me to find information about local World AIDS Day events or organizations in your region?